Hi, I'm Sophie. I'm the founder and CEO of Qunomedical. And I thought I wanted to address a few questions and misperceptions about hair transplant treatments and the full journey because they have come up multiple times. One of the biggest misperceptions I used to hear from our patients is that they are looking to get as many grafts as possible transplanted. So really, the more grafts, the better. And I think that's one of the biggest misperceptions about hair transplant treatments out there, because actually that's not the case. The reason why the more grafts, the better is not the case has basically many reasons. One of them is that you need, the way you should be thinking about this is the right number of grafts for you. So for example, if you don't have that much hair loss and just a receding hairline, you would want to be very thoughtful of your donor area and not over harvest. So just in case you need a second hair transplant in the future, you still have enough donor hair, for example. The second part is also density, hair density versus the area you want to cover. So sometimes it's better and will look better if you actually work with less grafts to create a natural kind of gradient of density over your head. So really, don't always be misled by the number of grafts, and doctors who offer you more number of grafts are not necessarily the ones who might be the most truthful for you. Actually, you should be looking for a doctor who can actually sit down and explain to you why that specific number of grafts makes sense. The other misperception I hear often is, oh, my hair loss is not progressed enough, and I'm just gonna wait for a few years until I'm almost completely bald to just have to go for a hair transplant for one time. And also here I have to tell you, it's actually, you should think of it as a treatment to maintain your hair density and your hairline. And oftentimes we get patients who are already too progressed and too bald, and therefore they are not able to get full density and coverage anymore because they were waiting for too long. So really, when you think about getting a hair transplant treatment, oftentimes going earlier than later is better, and then also you'd be able to get a second hair transplant later on, but don't wait for too long. Sometimes we have to, let our patients know that full coverage is not possible anymore. And the third misperception that I often hear is, oh, my friend went for a hair transplant treatment and he got great results, and therefore I'm going to get the same great results. And that is something that we hear very often, especially when all our patients are comparing the results with each other. And the thing to consider here is that everyone has a very different healing process and pattern. And healing and hair growth is also very dependent on your lifestyle. Do you smoke? How much do you drink? But also what type of supplements and vitamins you take. Are you on medication? Some of our patients choose to be on finasteride or take minoxidil and all of this. And in addition to that, every human being has a very different speed and way of recovering and growing the hair. So really, only because others are getting bad results or good results, that doesn't mean that this is necessarily the case for you. So I really hope I could clear up a little bit of the most common misperceptions that we have heard. If you have any questions, please comment below and I will make sure to pick them up in future videos of mine. Also, just for you to know, we have an offer running here at Qunomedical until the end of May. If you want to book your hair transplant treatment, I have a little gift for you. We are actually going to reimburse your flight ticket up to 100 euros. So get in touch with us and we'll make sure to help you find the right doctor and hopefully restore your hair density and hairline again. See you soon tomorrow. Bye.